The U.S. government is facing a potential crisis as Speaker Mike Johnson warns of a prolonged shutdown, possibly the longest in history. But why? It's a battle over healthcare policy, with Democrats and Republicans at a stalemate. The core issue, healthcare subsidies. Speaker Johnson's statement is a bold declaration, but it's not just about the length of the shutdown. It's a political standoff over the Affordable Care Act, ACA, subsidies, which are vital for millions of Americans. These subsidies, which help people afford health insurance on the Obamacare exchanges, are set to expire, and Democrats are demanding their extension. Republicans, however, argue that this issue can wait. The shutdown's impact, more than just a pause, as the shutdown continues, its effects are far-reaching. Routine government operations have halted, iconic museums are closed, and airports are struggling with disruptions. The economy, already fragile, faces increased uncertainty, and with Congress out of session and the Senate at an impasse, the shutdown could drag on indefinitely. A controversial strategy, using shutdown to negotiate. But here's where it gets controversial. The Trump administration is using the shutdown as leverage, firing federal workers and deciding who gets paid. This strategy, while legally within their power, is seen as a way to reduce government scope and force Democrats to the negotiating table. The administration has access to various funding sources, including Trump's One Big Beautiful Bill Act, to ensure their priorities are funded, even during the shutdown. The longest shutdown, a precedent. The longest government shutdown in recent memory occurred during Trump's first term, lasting 35 days. It was also over a funding dispute, this time for the U.S.-Mexico border wall. This precedent raises questions about the effectiveness of using shutdowns as a negotiating tactic and the potential long-term consequences. Healthcare debate. A long-standing divide. The healthcare debate has been a thorn in Congress's side since the ACA became law under President Obama in 2010. Republicans have attempted to repeal and replace it, most notably during Trump's first term, but these efforts have been unsuccessful. With a record 24 million people enrolled in Obamacare, Republicans are hesitant to try a full repeal again, acknowledging the deep roots of the program. The way forward, negotiation or impasse. Speaker Johnson insists Republicans are open to discussing health care, but Democrats must first agree to reopen the government. As the shutdown continues, the question remains, will there be a compromise, or will this become the longest and most damaging shutdown in history? And what does this mean for the millions relying on health care subsidies? The situation is complex, with political strategies and the well-being of citizens at stake. What do you think is the best way forward? Should the government reopen immediately, or is this a necessary negotiation tactic? Share your thoughts in the comments below, and let's discuss this critical issue.